So on today's episode of CPD, we have the personal trainer and CFT whiz, Maya Goodrum, who specialises in helping patients and clients with chronic pain become active again. And Maya has gone on the cognitive functional therapy course by Peter O'Sullivan, and she's going to be teaching us today as to how that relates to the rehabilitation care of our patients. Take it away, Maya.
Well, thank you. So as Elliott sort of just said, that I went on a course, it was a 3-day course regarding cognitive functional therapy, or CFT. It was a seminar led by Peter O'Sullivan, and over the 3 days I sort of learned the basis of how CFT works and what the whole point of it is. Basically, the whole point of Peter O'Sullivan and his research into CFT and how it's going to help people is mainly regarding lower back pain and chronic lower back pain. So generally something that isn't going to be potentially fixed. The reason why I put it in little quotations there, it will make more sense later on. But the reason why I'm interested in about this way of sort of approaching pain is because it's quite intrinsic with what I already understand about pain and how pain can be very linked to the brain and the cognitive side of things. And this whole thing with CFT is about getting people to be able to trust how they move with how their brain gives pain signals. So CFT, so the main thing is, what is CFT? It stands for Cognitive Functional Therapy. It's similar in concept to CBT, Cognitive Behavioural Therapy, but instead of focusing on the thoughts affecting our behaviour, i.e. our reaction to situations, it's more geared towards our thoughts affecting our function. I.e. when we're in pain, we feel we can't move in certain ways, we're more guarded. So it differs from other behavioural intervention in that pain control is explicitly targeted through behavioural experiments to modify functional behaviours. So for example, relaxation, reduced protective muscle guarding, safety behaviour and muscle control. Breath was also seen to be a big contributing factor in pain reduction, which I'll explain a little bit later on. So as a little bit of a thought experiment for you guys, pain. We can all think of times we've experienced good pain and times we've experienced bad pain. But at the end of the day, it's all pain. So what makes them different? So I want you to think back to a time when you've experienced bad pain. Get it sort of clear in your mind. And then also think of a time where you've experienced good pain. So good pain can be muscle soreness, when you've hit it really hard in the gym, other things. Sometimes there's sort of spiritual practices that involve pain. Bring those two things together and try and think about how you differentiate good pain to bad pain. So, who's got a thought process in the brain for that one? No one?
I feel like how threatening it is. So,
yeah.
So, if pain that I would expect to feel, sitting in meditation or exercising, I would expect to feel it. I'm in control of the fact that I did feel it.
Okay.
It's not surprising to me.
Yeah. So you say the difference between good pain and bad pain is expectations and safety. In control. Yeah, so knowing that you're in a safe environment, knowing that you're not going to do anything further to exacerbate that pain, all those kind of things. Does anybody else have any other sort of thing to build on that?
Generally, like context.
Yeah.
Kind of like like if you're kind of expecting it, sure.
Yeah.
But if you're like kind of working on a muscle that's a little bit sore,
yeah.
You know it feels like it's helping, and that kind of feels pretty good. With the belief of the pain, I suppose.
Yeah.
If you're like in the middle of a set and it's hard or it hurts, you might just push through because you know, okay, might be okay.
So a good example for at least 3 of you in the room, you do jiu-jitsu. You know you're going to hurt. You know someone's out there to hurt you. What makes you go back to that? That's still pain. What makes that better pain?
To not hurt as much the next time.
Well, yeah, there we go. So
to cause more hurt.
yeah. So that's it. That's it. So there's an equal dishing it out to receiving it, which can also cause a little bit of that balancing pain. You know, if you're trying to do something that isn't meant to be painful and it's suddenly painful, then that expectation's completely off.
What when you marathon, were you in pain towards the end or no? Like a lot of pain,
Yeah.
and it's all right. Like just shut it off and
Yeah, but then get like reinforcement from crowds and things like that, which kind of
Okay.
That's interesting.
Yeah.
It's just like, when we do things like that, if someone says to a patient and that, they're saying it's hurting, and then you say, yeah, it's all right, see if you can give me 3 more. They almost like got the reinforcement
Excellent.
to say, it's okay.
Mm-hmm.
Oh, interesting.
So, like you say, that is still a pain, but that reinforcement of it being okay and it pushing you that little bit further, and knowing that you'll get through it and everybody's on your side, made that a good pain. You know, it flipped the balance again. So this is where it really comes into the cognitive side of things, because if you feel safe in that pain, that what makes it a good pain. You know, there's a spiritual practice where people will literally have hooks put into their back and lifted off the ground. And one of the ways they get through that is breathing, taking the mind elsewhere. You know, it's not void of pain, but you see people do it and they look pain-free. You know, they're bleeding, there's all sorts of lovely gore going on. Yeah, it's a thing. But it's a spiritual practice, and they use their brain in order to take them elsewhere, and their belief system. Belief systems are a huge thing when it comes to pain, because there's a massive misconception when it comes to belief. So that's great. That's great that you guys get that. And that's sort of where I'm going to take this a little bit further. So there's obviously a lot of myths regarding pain, and this is what this particular trial, the Restore trial, went through. So let's go back to basically what pain is. So when pain is bad, pain, it's a protective function determined by the implicit evaluation of that the body is in danger, whether it's real or perceived. So that's where the bad pain comes in, because it's like, we are in danger, this is bad, stop. And that's that pain signal. Like I said, whether that is actually a real thing or a perceived thing, it makes the body feel like it needs to be protected. So one of the reasons why CFT particularly is looking at lower back pain as the main thing is because it is like the one biggest cause of loss of productivity, early retirement, and income poverty. So it causes all of these major issues, and out of all of the pain that people experience, that one causes the most issues. So research is showing that MRI scanning increases disability and the use of low value care. So generally people will then put through the system because they go get an MRI done. Generally they'll then be told they need surgery because a surgeon's going to tell you need surgery. You'll find people, especially the older population, they'll go get an MRI done. They'll go have a follow-up a couple of years down the line, and their back's deteriorated without anybody telling them that's a natural thing that's going to happen throughout your lifetime. But the data says your back's deteriorated. Look, the scans are showing that. So fear, instantly, pain. So you get a lot of that. You find that sort of passive therapy provides only a short-term relief. There's even been research into opioids for chronic back pain is no better than taking no opioids. Spine injections also only offer short-term relief, and spine fusions have been found to be no better than exercise interventions. So you're better off potentially not actually having all these massive interventions without trying everything else first. So people seem to think that they're broken, that there must be something wrong. Experiencing pain, got to be something wrong. And a lot of people believe that back pain is caused by injury, obviously. You find that 1 out of every 3 people can't actually recall an injury event. They find it's now been found that it's more linked to an emotional or mechanical stress, and that's why they think they've caused themselves injury. And 76% of those people report a previous episode of back pain. So they can think right back. I'm sure you guys have had it when you've had a client come in and be like, oh, I'm suffering with back pain. And they'll be like, oh, right, what happened? And it's like, oh, 10 years ago I fell over. It's like, well, if you're still experiencing pain 10 years later, what's going on? Because the body should have healed itself. So it even straight away kind of says that can't possibly be injury because it should have sorted itself out. That's what the body does. The majority of people actually cause injury when they're engaging in physical activity, when they're feeling fatigued or tired, which a lot of people will underestimate. They think, yeah.
Is that not just tired from being like out of breath or fatigued in the gym, as in like bad sleep, stress?
Well, yeah.
Okay.
So there's that's it. You've hit the nail on the head. Really, is that a lot of people will think, oh, I was just having an off day, without actually looking at everything else that's going on in their lives. You know, it's not like you just feel tired. There's never a reason, like never just that being a reason. So you find that people happen with that. And this is the thing, is like, let's say flare-ups are usually caused by either prolonged sitting, so not moving, stress or depression, depressed moods, lower moods. Research is showing that now. Second belief is that back pain is caused by tissue damage. This belief is quite an interesting one because it mainly comes from healthcare practitioners. So if someone's looked at their back and they've gone, yeah, that's the cause, without really investigating any further or seeing if something else might also be going on, because it's usually not always just one thing. A similar very thing with scans being a poor measure of pain and disability, because there's research now showing that there is more people with nothing wrong with their spine who experience pain than people who have something wrong with their spine and experience pain. So you don't have to have anything physically wrong with you to be in that level of pain. And the issue with a lot of that is obviously, like say, people go and have surgery to go fix the issue, and 30% of those people will then still have persistent pain after they've had surgery. What does that tell you about back pain? You know, it's more than just the thing that they think is causing it in regards to physical. Another belief is that lower back pain means something is out of alignment. There is no evidence, apparently, for slip disc, asymmetry, scoliosis, leg length difference as a cause of lower back pain. So there is no direct correlation of those things causing that pain. And I said that, like I said, there's more people with something physically wrong with their back who experience no pain. So what does that tell you about that? There's another belief that lower back pain is caused by joint hypermobility. There is no association with that, and it's not a prediction of future lower back pain either. So if you see someone who's hypermobile, it doesn't mean they're going to get lower back pain. Posture is another huge belief. So we're all sat very, very differently in this room. You're sat on the floor, cross-legged. The other guys are sat in the chair. But then going to that, we might be able to explore that as to why you feel like you can't sit like that. But the thing I was actually going to point out your posture, because at one point you were sat quite rigid and sat forwards. Why were you sat like that?
Just felt more comfortable.
Okay.
And then kind of just slouched and just crossed my legs.
So you're moving,
Yeah.
keeping the body moving. Brilliant. That's what we want. That's feeling more comfortable than you thinking, right, posture, got to sit like this. You know, if I sat like this for too long, my back is arched out. That's not a comfortable position for me. So I will start to experience low back pain. It's very, very for that person. So very specific to that person of how that's going to feel. So there is no perfect posture to protect the spine. And changing postures like you're doing will reduce lower back pain. So there is research into that actually keeping yourself moving is far better than not. So this is a really, really interesting one, which I mainly found more interesting because I'm a personal trainer, is it's dangerous The belief that it's dangerous to lift with a round back. There is research now that lifting with a round back is more effective because you're not straining up into it. There is slack in the body, driving for your legs. People with lower back pain tend to bend less. So what does that tell you about the mechanism of lower back pain? It makes you rigid. It makes you upright. That. So if that's the way you should be lifting things, why does lower back pain put you into that position? You know, it doesn't really make that much sense. And there is no evidence that lumbar flexion is a risk factor in actually damaging the back or causing lower back pain. So basically, we need to get people strong and confident and lift in a variety of different ways. Because at the end of the day, how we move in the gym generally isn't how we move in everyday life. You've got children. You know that you've got to run around with them. You've probably got to grab them from an awkward angle and things like that. So if you had to suddenly stop and think, oh, hang on, I've got to protect my back, got to make sure I'm bending my knees, got to make sure I'm doing this, your kid's off. They're gone, you know, before you've picked them up. Yeah, exactly. So if we made how people move in the gym more functional to everyday life, that would be a far better way of doing it. And there's a lot of fear around that. You see it when people push weights over their heads. They're like, oh no, I've got to be this way, I've got to be that way, you know, can't possibly bend and flex and move because of that fear. But if you can get somebody moving in that way with no pain, with no fear, it's far more relevant to everyday life. So far more functional. So from that, another belief is that lower back pain is caused by a weak core. There is no evidence for this. The core exercise, or the core exercise is that tension of your core is actually often linked to the protect your back narrative. So you will see how people move when they move in that restricted way. They're tight. Obviously, then that causes the pain. There is no evidence that a weak core is a risk factor either. And there's no difference between stabilizing exercises and general exercises. So generally, your core will look after itself without actually having to do these core exercises, especially for lower back pain. Like I said, people with lower back pain tend to tense their core more. And going back to normal behaviours, running around with your kids, things like that, picking up a moving object, telling people to tense the core before movement is not normal. And it just reinforces those protective behaviours. Breathing is more important. Another belief is that the back will wear out, that we do certain things if we work in a location, so you get things like nurses' back and things like that, that the back will just eventually wear out, and that's inevitable, that's going to happen. But obviously research shows that loading the discs will actually strengthen them. So it's so important to make sure that we are actually doing these things. Similar thing with back pain gets worse with age. Degeneration happens, but it's not always linked to pain. Very similar to, once again, where I said about people with actual physical back issues in regards to their spine. Some of them don't experience pain. So it doesn't mean that getting older means pain is inevitable. It is down to how we move. And that's what we find as we get older. We tend to move less. We tend to move less like we did when we were a child. And therefore, you're more likely going to be causing yourself pain because that's how life is. And another belief is that exercising with pain will cause more harm. So you'll hear it all the time. People will come in, they'll be like, oh, I haven't done anything because I didn't want to make it worse. And there is no evidence for that. It's painful exercises actually offered a small benefit over pain-free exercises. So it's sort of one of the teachings that you sort of teach is that you should move into the pain. Obviously not just go whole hog, but it's feeling into it usually makes the pain a little bit less. And that's a teaching you've always taught me as well. So it's safe to exercise in spite of pain. It's been proven. Another belief is that people feel like they need to take time off work. It has been shown that staying at work actually enhances your recovery. mainly because of the social connection, the distraction, the engagement, and rest actually has been shown to delay your recovery. So you're actually better to move than to not. And that pain exacerbations means injury. So a lot of people think because they're in pain, because they're experiencing more, they must have injured themselves. That's what goes back to that first one. But pain flare-ups are common. The thing that we need to look at most is stress, depression, inactivity, and things like that. They are much stronger predictor for pain. So what does this tell us about pain? It basically tells us that it's less about the physical and more about the mental. And that's where we're at. As a clinic, we do see people more as a whole rather than as some of their parts. And I think that's very, very, very important here. So
you were quite shocked by that when you went on the course, right? You were shocked at how many people came in with a much more reductionist.
Yes, and I can understand that can be a huge failing of our healthcare systems like the NHS and things like that. Private clinics, we have a lot more freedom to be able to explore different methods and of working as a whole. But it does seem out there that the majority of practitioners don't see a person as a whole. They're so narrow-minded on this is a problem, this is how we fix it, that they miss so much of the cues of everything else that's going on in somebody's life. And that's why a lot of people are still in pain. Unfortunately, that's sort of what these trials and the Restore trial brought up, was that we're failing people as a whole, as a country, and not just in this country, other countries as well. But the healthcare system is generally failing people because we're a lot of places, especially like the NHS, under so much stress in regards to timings and things like that. We just don't have the time to sit and talk to someone. Sometimes that's all we need, you know. So as sort of a example of that, one of the consultations that Peter done on the weekend was with a woman who he was seeing a lot of progress with. She then got a call from her surgeon because she was put on the list to have surgery. And she was experiencing no pain. She felt like she got to a really good place. Surgeon calls up and says, do you still want to be booked on? And she was like, maybe. I was like, well, you probably should. And instantly she was in pain again because somebody had knocked her confidence right back. And she's like, oh, maybe I should have surgery. The surgeon's telling me I need surgery. It's got to be bad. So then all of the mental focus is back in that area, back in pain after doing so well without being in pain. So how we talk to people really, really matters. And that's why sort of somewhere like this is why we've got to be really, really careful sending people for scans and things like that. One of the things I always say to a lot of my people, obviously I'm a personal trainer, slightly different area, but I'll have people in pain and they'll say, I think I need to go get a scan done. The first thing I ask is like, well, do you want surgery? And the answer is usually no. It's like, well, you get a scan done, they're going to suggest surgery. That's what they do. If you don't want surgery, you need to be able to do everything else to get you out of that situation. So that's where doing the exercise, doing the mental side of it really becomes so important, because if you don't want surgery, you need to exhaust every other option. Don't scare yourself with going to get a scan done if you don't want surgery, because it's just going to freak you out. So with that in mind, in regarding to it being person focused rather than just symptom focus, it all starts with the consultation. So we need to find out how to look at a person as a whole and not just some symptoms. So we're going to do a little bit of a workshop here. I want you to pair off into pairs, and we want someone who is a client and someone who is a practitioner. And I want the client to think of a time that they were in pain, and we're going to go through these questions here. So what you're going to do is you're going to ask your client just these questions and see what kind of answers you get from these kind of questions. Okay. All right. Feel free to pair off.
How did it begin?
It was jiu-jitsu related, but it actually started after I lifted up a towel and a drying rack.
Ah, I see.
How did it begin?
What treatment have you had?
I've been struggling through it really, to be honest, but I've had a little bit of osteo, which has helped a lot.
Really?
Surprisingly.
Okay, fair enough. What seems to aggravate you?
Chiropractic.
Car, so driving, being that. Driving the car for any period of time really.
What relieves it?
Excessive neck movement at the moment, like anything
Stay down.
sort of what I'm really interested
Does it hurt at night?
Those are the two big ones.
And driving at all, so say you're driving down the road, getting in the car
treatment?
seems to...
It definitely makes it worse. Like, it's worse afterwards. So it was a sort of build.
I'm not
But as soon as I'm in, it's like it feels like
Is that it? Is that what you need to do?
fair enough.
Okay, so it's done.
What relieves it?
I need to check. Where's the clip?
There's the traction exercise where you're sort of hanging your head off the thing. That's been helpful.
My mum is coming through me.
The osteo treatment actually helps. That gave me sort of a good weakness and relief.
That's good.
I've just had a couple of sessions that really helps.
What does it look like? R-E-L-I-E-S.
The main ones really.
Yeah, I yeah.
Yeah.
So.
And does it hurt at night at all?
Yeah, at night is bad actually. But it's almost worse in the morning when I'm first waking up. That's when you really,
Well, we just need to talk
really
about
stirred
that.
up. But
Sure.
Okay,
I'd
so
say
There's another bit to it.
it does bother my sleep at the moment.
It's the secret, fair enough.
see.
And what are your expectations for
Door
treatment?
number one.
But you can have a positive effect upon the pain and the function, probably.
Cool, that's
Yeah.
fair expectation.
That's like layman's terms.
Yeah,
Yeah.
sweet.
See why he always runs over in his consultations.
Given the time, cognitive, functional.
We're always through the list. I know,
Well, now
Okay, so right, so we'll start with you guys. How, as a let's go with the client first. How did that make you feel as a client? Did you feel like it kind of got to the point, or did you feel like you wanted to say more but couldn't?
No, I think it was pretty good inquiry.
Yeah, you felt all right with it?
Yeah, no, it was good.
How did you feel?
It was good. Like, yeah, there was probably other bits you could kind of like delve into a little bit and see like the osteo helps. Like, why did that help? And that sort of thing.
Yeah.
He's tried some exercises, which is good. Like, maybe sort of asking like, why did it feel good?
Yeah.
How did it feel? Maybe.
So you found yourself wanting to ask more questions?
A little bit, yeah. I think
Yeah.
I like inadvertently did anyway, but then just had to stop.
Yeah, that's it. So you kind of made the consultation better by asking a few more open questions.
Yeah.
Brilliant.
But, yeah.
And you guys?
I thought it was rigid.
Yeah.
It's got a little bit clumsy.
Yeah. Yeah. So you felt like it didn't give you the opportunity to explain your story. Cool. Okay.
I definitely felt like it didn't give me an idea of you at all. You know, like that's that. After asking those questions, I had no more information as to who you are, what your values are.
It goes almost like that.
100%.
Yeah. So you don't, from what I'm hearing, is that you don't feel like you've been seen as a person, and you don't feel like you've learned anything about him. Yeah. Cool. Okay. So we're going to do that again, and well, basically this is echoing exactly how people feel about how they're treated in health service. Is that they feel like they are rushed, they feel like they're not heard, they feel like then the information they're given, they have no idea what they're meant to be doing, where they're meant to be going, how they're meant to be doing things, and they just feel rushed. And that is a huge thing in the health service at the moment. So like I said, we're going to do it again, and we have more personal and person-centered questions to ask. Okay, so these are the ones on the other side that are hidden. So you get to get the reveal. All right. Feel free to do exactly the same thing, same client. You can talk about the same pain if you want, and ask those questions.
Yeah, my hip's been really hurting recently. I don't know why. Just played a bit of football, bit of a rough game. Can you get his phone out? The student.
Yeah. He's been out of school too long.
Seen but not heard.
Yeah.
He's explaining.
Can you share your story?
Yeah.
What's going on at the time?
Just played it. I was playing a bit of football. I'm not like very good at it, so I was just like running around everyone. It was a pretty rough game, and the hip started feeling more and more sore every day.
A few days later, my back started hurting.
What impact has this had on you?
It's not stopped me from doing anything, but it's just made everything more uncomfortable. Like, just driving sometimes,
It's already kind of naturally
walking,
So you can also
stairs. So I feel like a bit of an old man.
Sure. What is your understanding of that?
It feels really deep in there. It feels like a joint thing. That's probably it. Really. It's quite sharp. So I don't know if it's something's out of place or something. I don't really know.
Was it like an instant moment for you?
No, I kind of felt it afterwards.
Yeah.
Yeah.
What is your understanding of course?
What do you think? I think I'll ask that one. How does it make you feel?
Not great, because my hip hurts really.
Yeah.
So I want to be able to do everything.
Yeah.
I want to do other stuff, not just play football.
What do you feel was going on?
So I'm not great at it, so.
No. Needs
Need my experience.
And what are your goals?
Just feeling good, so I can just attack
But you also
anything I'm doing,
said
like gym and whatever.
you also said that you felt something shifted.
That's really it. And go back to football as well.
Yeah.
How does this pain make you feel?
Get back amongst it. Social stuff as well.
Exactly, yeah.
Alright.
Cool, thank you.
All right. So, sorry, I was listening sort of in on your conversation. So, how did you feel that was different from the first lot of questions?
It was just a case of what's going on, sort of thing, and just how I feel about it. Well, I felt way more heard than Josh would have done.
It sounded like you almost went to touch on like your actual goals for it. You wanted to do more than just play football. You wanted to be able to do with that. And there was no way that you got that from that first conversation.
No.
You know, so it's once again not talking about the actual pain or the actual thing. It's talking about everything else that's important regarding that. Did you feel that that's sort of where the path went?
Absolutely, he was trying to understand like what I think of it as well, which is important to start building from that rather than just saying this is what's going on and then I'll think, oh, this is definitely not what's going on because I reckon it's this. And then it would just be a bit of a disconnect, I suppose.
Okay, so as a practitioner, did you feel that you got more information out of him just simply by changing the wording?
Yeah, absolutely. I think it, like I said, just gives you a bit more opportunity to elaborate on the bits and maybe think about it rather than just surefire questions, surefire answers rather.
Yeah, that's good. So like I say, it allows your client to elaborate on where they're at with pain and where they're at with their understanding of what they're going through as well. And then what you then get from that is, rather than, because you might have seen the person walk in the door, you've probably clocked them straight away in regards to how you can help them, but they don't know that. They don't know that that's how it's going to be. You could be the best person in the world, you could see these invisible pains and be able to sort it out in seconds. But if they don't trust you and they don't have rapport with you, it's not going to be a beneficial.
As a patient, it took the time to kind of understand the ins and outs, even though you asked many kind of follow-up questions. It was just a case of what's going on, sort of thing, and just how I feel about it. I felt way more heard.
Yeah, it sounded like you almost went to touch on like your actual goals for it. You wanted to do more than just play football. You wanted to be able to do with that. There was no way that you got that from that first conversation. So it's once again not talking about the actual pain or the actual thing. It's talking about everything else that's important regarding that. Did you feel that that's sort of where the path went?
Absolutely.
Yeah.
You're trying to understand like what I think of it as well, which is important to start building from that rather than
Yeah.
saying this is what's going on, and then I'll think, oh, this is definitely not what's going on because I reckon it's this.
Yeah.
And then
Okay. So as a practitioner, did you feel that you got more information out of him just simply by changing your wording?
Yeah, absolutely. I think it gives you a bit more opportunities to elaborate on this and really think about it rather than just short questions. Short fire answers as well.
Yeah, that's good. So yeah, like I say, it allows your client to elaborate on where they're at with pain and where they're at with their understanding of what they're going through as well. And then what you then get from that is, rather than, because you might have seen the person walk in the door, you've probably clocked them straight away in regards to how you can help them, but they don't know that. They don't know that that's how it's going to be. You could be the best person in the world. You could see these invisible pains and be able to sort it out in seconds. But if they don't trust you and they don't have rapport with you, it's not going to be a beneficial. That's exactly what we see with surgery and things like that. If people do not believe that it's going to be helpful, it's not going to be helpful. You two, how did you feel?
I just felt that like I could, if you was asking me to write a story out of either one, it would just be an absolute dream to write a story of the second version as the third, but I had nothing. But with the second, David naturally gave me part of his values, part of his concern, his goals, also his internal experience as well as the external experience, what he physically can't do, but also where he's mentally inhibited from the pain as well.
Yeah. So this is one of the biggest parts of CFT. So it doesn't really come down to actual hands-on treatment. So it's all about the consultation. It's about learning somebody's story and understanding where they're at. And that's, like I said, you could literally write a story from the second lot of questions rather than the first. And it's all about understanding that the client is more than just their pain. And that there usually is a lot more going on. You can usually pinpoint a pain to not just a injury or trauma response, but it can also be that they were potentially stressed around that time, or potentially that they weren't eating so great, or they weren't sleeping so great. And there's all things that play into how somebody reacts to their pain. Very similar to what you asked earlier about fatigue and that kind of thing in the gym, is somebody's more likely to hurt themselves because they're distracted. Their brain's off somewhere else. So one of the first things to ask when somebody says about their pain is to ask, well, what's going on with you at the time? Were you going through a breakup? And they don't even have to be negative stresses. They can be, I'm getting ready to move house because I'm moving to this beautiful new house. It doesn't have to be a negative stress, but it's still a stress that distracts the brain into something else. So it can then make somebody obviously, it just makes everything bigger. So pain gets bigger, issues become bigger. Everything is something that is going to play into something being worse, basically. So that is the thing with these consultations. It really is getting that rapport and getting to understand that there will be things that the client wants to get back to. So it can be something as simple as they want to be able to dance again. They want to be able to run around with the kids. They might want to even just be able to sit up out of bed without any pain. There are certain things. So when that happens, you've then got to make the treatment viable to what that person wants to get out of their function. So that's where it gets really important in understanding their story. Because if somebody only wants to be able to walk up the stairs pain-free, and now you've got them deadlifting and running around and doing all this, it's like, well, that wasn't really relevant to what they wanted to get better at. It's good exercise, it gets someone moving, but it's about making it relevant to what somebody wants to do.
And the fact that they see that it's relevant.
Yes.
See that they're getting closer and closer to what they want.
Yeah, Yeah, so the goals, because one of the things that help people stick to goals is their understanding of why they're doing it. This is a big part of it as well, is that any resources you have, send them over to your clients. If, as an example, if somebody wants to learn about different dietary things, I'll send a podcast I've just listened to that has some really good information on it. Send some YouTube videos of somebody going through the same thing. You know, it's making it something that's relevant to them, and also so it's not just me again. You know, I could record our session and send it off to them, but that's probably not going to be helpful because it's not something else reinforcing the positive. So it's important to find sort of ways that you can help a client, not just by yourself. You know, it's about sharing the story with everyone. So one of the really, really interesting things that we can see with this is that you want to target someone's behaviors. So it's not just their movement or their thoughts, it can also be the behaviors. So you don't want to buy into their worries. So if somebody's really, really, really scared about something, you can reflect it and be like, I can understand you're scared about this. But what you don't want to end up doing is being like, yeah, you should be scared. You know, because obviously that's just going to reinforce negative emotions. You want to be positive. So you've got to almost be the confidence in the face of their fear. And that's what we can offer as practitioners, is to be that steadfast, no, you'll be fine, don't worry about it, because it all comes down to that worry. You want to validate the person and invalidate their beliefs. So at the moment, if they're in pain, the majority of their beliefs are negative. And you want to be able to validate the person as a whole, and that they can get back to where they want to be. Because a lot of it is getting back to where you was, not even going forwards. It is just, I want to be able to do this again. The last thing you want to do is turn around and say, well, actually, you probably won't be doing that again. You know, who are you to say that? You want to be able to reinforce that they can do that again. It's very, very important. And this is where it comes quite interesting in regards to the consultations that Peter done. So for the course, it was a 3-day course. The first day sort of went through all the trials and the belief systems and all that. And then the next 2 days he did consultations. So he'd done live consultations, and about an hour and a half each. Obviously we don't have an hour and a half to sit with someone. But in that time, at least 2 of, I think, the 5 consultations he done, he didn't touch them. There wasn't a single bit of manipulation in regards to physical manipulation or actually treatment of what you guys would regard as treatment. He just spoke to them. And he spoke to them, got them to relax, got them to understand that their pain was probably a lot deeper than they even believed or understood. And it was quite incredible to see these people be in so much pain, and then just almost the pain melted away, because there's so much trauma and stress that they held on to that they didn't quite understand that was released. And I'm sure you guys have had it before. I know I have. I've had clients come in, I'll be like, you're all right? And they're like, yeah. I'm like, that didn't sound convincing. An instant, that's it, they're off. So for that session, take them into a quiet room, we sit and chat. It's knowing that a person, what they might need in that moment might not be what you think you need to give them. And letting somebody go through their emotions. Because a lot of the time when people come in here, that's probably like the only half hour out of their whole week that isn't stress, work, kids, you know, sleep, repeat. It's their time to come in here and just relax. You know, even though they're in pain and they want to get out of pain, a lot of it is just that talking to someone. And it's a huge deal. And I'm sure you guys have seen it with a lot of clients, that that's a huge part of it, especially with clients who keep coming back week from week and you're like, guys, you're better. And they're like, well, I might not be. And it's like, because you're offering more than just pain relief. You know, it is the therapy side of it. And without saying that we are therapists, because obviously we're not, but it's a huge part of it just to have someone be heard. I mean, like in our own experience, I'm sure you've had it when you just want to talk about something, and then somebody you go for it, and then they just wall up, can't talk about it, and it's like, all right, great, now I feel worse. You know, if you can be that person that somebody can come in and just they can relax around you, you've got it, absolutely got it. It's so important. And then if somebody can relax around you and they trust you, they're going to trust all the process that you'll take them through. So, like I said, that's a huge part of it. But obviously there is also the moving part of it, and this is where we do need to apply it to actual form and function. So we've sort of gone through the cognitive side of it. This is more to do with the movement side of it. So obviously one of the best things that you want to be able to do straight off the bat is to dial the system down. So you don't want to start moving someone when they're up here and they're stressed and they're tight. So that's where the talking part comes in first. Get somebody to relax a little bit more, whether that is actually literally going through breathing techniques or talking about something and then moving on to something brighter and happier. And then they should relax into your sort of what you're then going to do with them. So one of the things that you want to see is how somebody moves. That's a huge deal. You guys all see it. You all make somebody move. They'll be like, all right, I've got a pain here. All right, let's see how you move. Very important. This is something that's really interesting is somebody might be like, oh, I can pick up a really heavy weight. I deadlift this, I do this. But then you see them pick up a water bottle off the floor and they're all like, oh, pain, you know, they instantly stiffen up. They move in such an awkward manner that it's like, well, no wonder you're in pain. You've got to get a client to understand and reassure them that they'll be safe. And you want to get them to know that they're not going to hurt themselves when they move unguarded. And like I sort of mentioned, this is where the breathing part comes into it. So it's quite interesting because actually on the course, he didn't really explain why the breathing was important. I've kind of pieced together the pieces of that because of my understanding of breathing and the fact that I do a breathing practice every day. Breathing is so important because it relaxes the body. And that is on a level of neurological science. You breathe into the diaphragm and it will relax the vagal nerve at the back of your neck, which literally relaxes the body. That's why when you hurt yourself, somebody will instantly be like, breathe, make sure you're breathing. And that is because it relaxes the body, it regulates the heart rate, regulates the blood flow. So if you're moving in pain and not breathing, it's going to tense everything up. Everything's going to be so worse. And so what you want to make sure when people are moving is that they're breathing. The amount of time people hold their breaths when they're moving, especially with pain, is incredible. And a lot of the time they're not even aware of it. So that's something you've got to be really vigilant of when you watch your clients move, see if they're breathing, because that is such a guarded behavior that you want to try and get out of them. It does apply to big movements, so like deadlifts, things like that. We're all taught that you need to brace, and generally that means that you don't breathe. You brace, you hold, and then you breathe at the top of the motion. You breathe through the motion, you won't experience pain. I've trialed that myself. I've trialed it with a lot of clients because generally what happens the majority of the time, you know how to lift something off the floor. You use your legs. You lift up with your legs. But as soon as you're in pain, your focus is in that back and then you round and pull with the back. You're not then pushing with the legs. If you can breathe and focus solely on the breathing, it takes the brain away from tensing in the wrong places. So it's basically another distraction technique. Yeah.
Also, like, also like mindfulness, like it brings you into the moment, or it
Yeah.
brings you into like a smaller time period rather than 5 reps is now 5 breaths. Or
yeah. So it's very similar to a meditation practice. Is that your brain is now focused on a point rather than focused on everything else. So you're focusing now on your breathing rather than your pain. So it sort of plays into that as well. So a really good practice is to exhale, obviously say with a deadlift, exhale on the way up, inhale on the way down, and use that as your guide for how fast your movement's going to be. What you will see, the majority of people will grab the bar, they'll hold their breath, exhale right at the top. That's just tense. That's causing so much tension all the way through the core, all the way through the back. And the majority of people end up with pain because they literally haven't taken a breath. And it's so, so important. And that's something that I would like you all to try, because I know that the majority of us don't breathe right because we've been taught for so long that you need to brace your core when you lift. You don't, you need to use your legs. The core doesn't really do much in that lift, it's through your legs. So that's another thing that I get people to focus on. As soon as they say, oh, my lower back hurts, so don't focus on it. Focus on the working muscles. Bring that mental focus to the working muscles. They do a set, they'll be like, oh, I didn't feel it in my back. It's like, brilliant, because you weren't focusing on it. So once again, what does that tell you about pain? It's neurological. It's where your brain thinks, oh, I'm going to do myself pain. That's it, I'm done. You lift, I'm in pain, because your brain's already in that stance of this is going to hurt. You know, going back to you guys fighting, you know, you doing your jiu-jitsu, is that you know it's going to hurt, but you know that you can also do it back. So you're already in the fight mind of, I'm going to hurt them, not they're going to hurt me. If you just went in with that, you'll probably lose your fight because your brain's already in that thing of this is going to hurt, like with no thought process of then let's go and hurt that person. You know, it's that sort of mentality of being positive with what you're doing. If you're going with a negative mindset, it's going to have negative outcomes. That's with everything. So you want to move away from the pain and more into the function. This is why movements like deadlifts and things like that are quite good to use when teaching this practice, because the majority of people are scared of picking things off the floor. That's the most of the time when people think they've hurt themselves or they're going to hurt themselves. So if you can get them knowing that they can deadlift, say, half their body weight, picking their phone up off the floor or picking a water bottle off the floor shouldn't be any issue. But you will probably still have to train both at the same time. So I said I've had clients where they will do their deadlift set and then they walk over to their water bottle and they're moving all guarded again. And I'd be like, why are you doing that? You've just shown me you can lift. And not even sometimes with good form, you know, of how they think they should be moving. They've just lifted half their body weight, brilliant, no pain, no issue, hurt themselves picking their water bottle off the floor because once they're guarded. So it's linking movement patterns to safety and get them to know that they can move safely with a bit of breath, a little bit of focus. They'll be able to do that absolutely fine. But it is the breathing part. Breathing is really, really, really important with that. And sort of as we go forwards with those kind of things, speed of movement is usually the biggest predictor of change. So you'll see it with clients who are in pain. They usually move slowly and guarded and make sure that they're not going to hurt themselves, even though they're currently hurting themselves by doing that. As soon as somebody starts to move quickly and, well, pain-free, they're not even thinking about it. That's usually a really, really good indicator that they've got their brain in the right place with it. So with that, it's sort of making sure once you've seen somebody move, is then getting the client to understand that they are in control of their own journey. So really relay back everything that you do with somebody in the gym or in the practitioner room back to their goals. So make it make sense, basically, because a lot of the time I think sometimes people are left with a lot of confusion. They don't really understand why they're doing something or why it's important, or even sometimes what muscles they're activating. You know, if they can really sort of get that in their brain, it's going to make a lot more sense. In regards to activity levels, you want to, obviously, a lot of people come in completely sedentary, so anything's going to be great, but you want to try and get them to at least sort of 150 minutes a week of movement, a couple of sessions a week, 3 sessions a week, or something like that. And don't let their pain dictate their progress. Pain is very much like your mood. Some days you'll be in more pain, some days you'll be in less, especially when you're looking at things like chronic pain. You know, somebody who will always be in pain for the rest of their life, it's going to ebb and flow. And is the interesting thing about pain as well, is that sometimes, a lot of the time, you'll find people don't even realise the days where they have no pain. It's almost like you just get on with your day, but they've not even clocked that, oh, hang on, I've not thought about my pain today. And it's like, oh, I guess I wasn't in pain today. You know, it's very, very rare somebody will first wake up and be like, brilliant, I'm not in pain. So it's a really funny way of looking at progress. Yeah.
Just out of interest, did they suggest any way? Because often we'll ask, for example, on a scale of 0 to 10, where you are in terms of progress or your pain level, if their perception is biased towards the days that they are in pain, did they talk about any other ways of asking about progress or measuring progress?
It's to make it less pain focused.
So you can focus on function.
Yeah.
Okay.
So it'd be like, how many days have you been able to run around with the kids?
Yeah,
you know, how many days have you been able to do that goal that you were looking for? You know, it's make it less about how many days have you been pain free, because like I said, that's not a really good indicator, because a lot of people don't remember the days that they're pain free, but they remember what they did on those days.
Yeah.
So it can be a different way of creating that question, because once again,
So we can keep going back to, okay, so say David said that his goal was to go back to DIY or to say that's your 10, 0 where you were when I first saw you were on today.
Yeah.
So okay.
Yeah, you're right. How's your DIY going? That's going to be a really good indicator of where they're at with their pain, because that's the first thing. If he's experienced a lot of pain, that's the first thing he's going to tell you is, oh, it's not done very well because I've been in a lot of pain. But if he turns around and says, got it all done, brilliant, loved it, you know, really proud of it, you know, they're going to have all these really positive words around that goal. Whereas if you had got it all done, but you were still in pain, it might be like, didn't do the best job I could have done, you know, then there'll be negative words around it. So it really is sort of tuning in with people and almost going on the journey with them, rather than just focusing on the pain. So it's also changing how you talk to then get how they talk. So, and that's another thing with it, is you can't change the stresses in a lot of people's lives. A lot of it's work, a lot of it's kids. You know, you can't get rid of work, you definitely can't get rid of the kids, you know. So you've got to give them tools and how to deal with those stresses. One of the ways that I personally deal with stress in my life is to have a really solid morning routine. I find that the days that I've done my morning routine, I can tolerate people better. The days I haven't, my tolerance levels are shot. I can't interact with people very well. So it's about bringing that stress, so you're not up here, you're down here. You start low because stress will build throughout your day. If you start up here and stress builds, you're gone. So if you know you're going to have a particularly stressful day, you already perceive that's going to happen. If you can find ways in order to release that stress, you're going to go into that day a hell of a lot better. And probably in the long term will feel less pain, because you've got these techniques, you've brought it down. So you're not just full of stress and pain and then just going through your day. So that's really, really important to make sure the stresses are managed. Diet's important. It's a huge thing now. There's a lot more research into ultra-processed diets and how much inflammation they can cause. A lot of back pain is caused by inflammation. So if you can reduce that, you're going to reduce that as well. And also mood. You know, we've already said how much mood plays into lower back pain in regards to negative thoughts. Diet affects your mood. You're going to wake up, you're going to have a crappy day. I certainly know the day after I've not eaten well, I feel like crap. And that's not just a physical thing, that's a mental thing as well. Yeah, there we go. Knees hurt, joints hurt. Yeah, diet's not great. Feels like your body's falling apart and you can't pinpoint it. And it's like, I had that pizza last night or something like that. You know, a lot of people underestimate how much that affects the body, which is crazy, because that's what's fueling your body. Get the fuel right. Well, talking in those kind of terms, you put the wrong fuel in the car, you bugger it. You put the wrong fuel in your body, you bugger it. So fuel it right. But the easiest way to do that is to eat whole foods. You know, anything that's not too processed, whole bunch of rainbow veggies, brilliant. There's a lot of research now into you're better off being overweight and active than thin and inactive. So move. That's one of the biggest things I can say is just get your body moving, and stay the course. I think a lot of people seem to think that they only need to do one thing once and they'll be cured. Repetition is key, and that's something you've really, really got to drive home with clients. But once again, if you are giving them something that they say they like to come in here because they do like a chit chat, and they're going to pretend they're in pain a little bit because you then get to see them, understand that's probably why they're seeing you, you know, but yeah, they just want to chat, you know, and that can happen. Somebody will sort of somewhat exaggerate their pain for those purposes, but let that be all right, you know, let a client know if they want to pay whatever to come in for a chat, they're welcome to. You know, I would like to say I offer more than that, but it does help. It helps somebody on their journey. One of the main things that I pretty much put down here in capitals is relax, breathe, and move. I think that's so important, and that is sort of everything that you kind of take away from sort of a person-centered approach to things. So,
sorry, just
yeah.
Go back to the better to be overweight and active rather than
Inactive and thin.
and fit.
Yeah.
Anything particular, like from a metric standpoint, that they were looking at there? Was it like you went if it was is it a disease standpoint?
It's specifically, I cannot remember the specifics of that. I do have a very good podcast I can send to you. Yeah.
What's the question about what aspects of it is?
Is it known to be fit? Because I know most people, particularly my mum, basically, like she's been trying to lose weight for years. She's doing everything. Everything at it. I always tell her like you're so much more active, but it's still not achieving. She wants to lose weight at the end of it.
Yeah.
So you're not relating to health outcomes, right? So much.
Like obviously, like, I know the obvious benefits, but I didn't know if there's anything.
Oh, I think for strength training mainly, isn't it?
Yes. So resistance training is a huge one. They recommend that you should be doing at least 3 sessions a week, just resistance training, and it is longevity, because obviously your muscles are the things that metabolize all the foods that you eat, and then it is down to sort of disease control and those kind of things as well. You know, that is everything that's going to make you live longer and better.
In women, exercise reduces breast cancer by like 2/3 or something.
Yeah,
like that.
There's a massive amount of research into it, and it's all areas. It's not just one area of fitness or health. It is everything. It's hormone regulation. It's like I say, longevity. It's quality of life as well. Yeah. That's it. So that's all the physical side of it, and mental side of it as well. I know I feel mentally better after I've exercised.
Oh, also, one last thing. I remember reading, even with runners who don't do resistance exercise, they lose weight up to like 40% of it can be muscle mass.
Yeah.
So a lot of people I have seen have gone through this cycle of binge diet without exercise, and then they notice that the weight goes back on. They then binge diet again. With every cycle, they're probably just reducing their muscle tissue and therefore reducing the basal metabolic rate as well.
Yeah. So it all plays into each other. So before I ask if you guys got any questions, basically the main 3 building blocks of CFT is making sense of pain, exposure with control, and lifestyle changes. If you can get those 3 things together in treating your clients, you've got it. It will be far more helpful, and you'll see people get better in a much better way, rather than keep on having the same reoccurring problems over and over and over, because you're not just treating the symptoms. You're treating everything that could play into it. So yeah, that's pretty much everything that I went through with that. There's a few other sort of takeaways from it, but it pretty much is let a person be seen. That was a main takeaway from it, is if you can treat someone without even touching them and not even seeing them move yet, and it reduces their pain just by talking to them, talk to them. You know, it's a huge deal.
I've had that about free consultations.
Yeah. Yeah, exactly. So what does that tell you about pain? You know, it's exactly. But that is the flip side of it.
That's why we do it.
Yeah, that is why we do it. You know, I could quite happily, you know, coming from my point of view from it as a personal trainer, a lot of personal trainers will keep their clients in a bad state of health because they want the clientele. If they can kind of just lie to them a little bit and be like, yeah, keep going. Yeah, it's the same with the pharmaceutical industry. You know, medicine will keep you ill.
I've had two patients in the last week. Their nurse or their doctor who they see, I think they're over 50 years old, both women. And the nurse or the doctor said, "Well, you've got any medication at the moment." As if like
yeah, that's it. You know, they've got to find something wrong with you because they want to put you on medication. It's the health industry is keeping people sick, and that is what we as a clinic want to do to help to get people out of that, because it's barbaric, really. I couldn't do that. My soul would not rest if I had done that to someone just for pure gain of earning a bit of money.
Our job's kind of to be kind of irrelevant.
Yeah, that's it. That's it. That's one of the first things I will tell my clients. Yeah. First thing I tell my clients is, that's it.
Doesn't get too good.
I always say to a client is that I want them to get to a point where they do not need me anymore. And the majority of people end up coming back because they like to chat. You know, that is one of the reasons why they keep themselves here, is because they want to come in and have a bit of social, which is brilliant. That's another thing that's going to help with the mental side of it. But the majority of my clients now can go off and do it on their own. They have the confidence, they have the tools to do it. But if that's what keeps them coming back, brilliant. That's down to them. But I would never keep someone unfit or unwell. So any questions at all? I know that was all a bit much all at once, but
that's really good. Definitely will. Like so many things where I'm going to change significantly the way I'm just communicating with people. Like even just that exercise talking to Dave, I'm getting everything that I've needed. Because I would say my framework is mainly on the left.
Yeah.
But I end up going to the right.
Yeah.
And it's nice as I just go straight to the right. So.
That's it. I mean, like, that didn't take any more effort. You know, there's not that many more questions there.
It was quicker. David naturally went down the rabbit holes that I would have to guide patients down, whereas those questions naturally just...
Yeah, exactly. Any other questions at all?
What if they don't have an understanding of it, but they just kind of don't know what's going on? They're kind of lost. So would you kind of go down the route of kind of potentially explaining down the line? Or, because I've had some people where I've asked that, what do you think is going on?
Yeah.
They said, I have no idea.
Yeah.
You're the expert, you tell me.
Okay.
That's helpful though, isn't it?
Yeah.
Them saying they have no idea, because then it's like their health literacy or...
Yeah, so it's interesting. So on the complete flip side of that, Peter went through a consultation with a guy who knew everything. He understood the psychology behind it, he understood the neurology behind it, but he was still in pain. So what? Then what do you do? Like I say, it's the flip side of it.
And then is that the case because he's not walking the walk? Because he knows what he should be, he knows what's happening, but he's not acting as though he knows what's happening?
Potentially.
Okay.
He would get into pain and then stop.
Yeah.
You know, so as long as you can get people to understand that, then, like I say, there doesn't need to be a cause. You can get them to understand there does not need to be a cause. That then you can treat it as you would anything else. You know, it can then be like, okay, let's look at your stresses in your life. Let's look at how you're moving, because something might be contributing to it, but it doesn't need to be something that they're knowledgeable about. It doesn't need to be something that they know, because something's going on, or they wouldn't be in pain. So they don't need to understand what's going on with it. But through talking with people, you'll find a snippet of like, that's what it is. You know, and that's the thing with trauma. You know, the majority of trauma, people don't even know they went through. And it's not saying that everybody went through a traumatic experience who has back pain, but there's so much of the brain that protects itself. And if you can slowly sort of unlock that for a person by asking these kind of questions, they might eventually be like, light bulb moment, got it.
That's where it's more like an ecosystem than a cause effect, right?
Yeah.
I'm not saying that your stress caused your pain. You said that it didn't help at the time.
Yeah. It's very possible. And this is a really, really interesting thing as well from my own experience. As soon as you put me on this course for lower back pain, I got back pain. Yeah. Yeah. Because that's all I could think about. And then I'm thinking about how can I... Yeah. But this is the thing. My brain then went to, how can I be the person to help people with low back pain if I've got low back pain?
I would have thought you'd be more able to understand it more.
More expertise.
But that developed me having low back pain.
Yeah.
Because that's all I could think about.
Yeah.
You know, it's one of those sort of weird things that happens, because as soon as I done the course, as soon as that 3 days was over, I was fine again.
Yeah. I sometimes get it when people tell me about their pain.
Yeah.
It's like she like 10 cell one. Like,
Mm-hmm. But it's not a bad thing from a practitioner's point of view, because it shows you're empathetic.
I was gonna say probably on that course you do a lot more sitting down.
Yeah.
Yes,
True.
so your shoulder will not use it.
Yeah. Yeah.
That's in itself for you.
Mm-hmm. Yeah. There's a lot of that. So yeah, it's finding someone's baseline basically. But yeah, it's not a bad thing that we feel like that, because it is empathy, and as a practitioner, you need it, because how can you help someone if you can't put yourself in their shoes? How can you help them? You know. So that's sort of the takeaway from it, is go on the journey with them, because that's going to be far more helpful if they know they've got someone there than you just being like, yeah, do these exercises, see you in a couple of months. You know.
Just last one. What would you do with someone that's got a very chaotic life? Like, someone's a mom, like, even like does take together the whole house and also works. There's like very little time for them to make time for themselves. They're literally thinking about what's the next three things.
Yeah.
Like, Tilly's got swimming, Sarah's got this, Tilly's going to do this. I don't know. It's like 1950s kids.
So there's a few bits of advice with that. It's obviously sort of, once again, working out where they have gaps in their life.
Yeah.
They quite literally have no gaps, and they feel like they are on the go from the moment they wake up to the moment they go to sleep. I sometimes say, like, if you're waiting for the kettle to boil, just lay on the floor for 5 minutes.
Yeah.
Just take a moment doing nothing. Because if you can just go and do nothing and just empty your brain, go and sit and just nothing, not even think about trying to do nothing, literally just do nothing. That's why laying on the floor, because it's uncomfortable, is not the best thing in regards to, you know, like sitting down on the sofa and watching a bit of telly. It is nothing. And I think we've all lost the ability with being comfortable with being uncomfortable. And that's a huge deal. So if they can find 5 minutes, I say, waiting for the kettle to boil, lay on the floor. It seems somewhat simplified, but it is that thought process of doing nothing, because that is a majority of the time that they're, like I say, their mind's whirring, constantly whirring. If you're forced to do nothing, that's all you can do. So 5 minutes out of your day. I am sure there is not a single human being on this earth that cannot take 5 minutes somewhere.
Yeah.
You know.
Yeah, especially if it's doing nothing rather than like, oh, try this stretch or exercise.
Yeah.
It might be a little bit uncomfortable. It takes a little bit of mental capacity.
That's it.
That's actually good. Good both kind of like having an in to do stuff for
Yeah.
themselves.
Yeah, because like I say, that's then 5 minutes of themselves. And yeah, I've done that technique. I think it's pretty useful. And something about laying on the floor as well. I think it kind of almost regresses to that childlike. Because when have you laid on the floor as an adult? You know, like when have you ever just, well, yeah, there we go. You know, a lot of people don't connect with the ground. And it's sort of just getting yourself back to that. That is something somewhat therapeutic for that process as well, and especially a hard surface. The majority of people are sat, even if they do lay, they're laying on something that's soft and cushiony. You know, it's like I said, get comfortable with being uncomfortable. I think that can be a good way, and that also then relates to how you deal with pain. Because if you can be comfortable with being uncomfortable, that sort of acute pain that you're feeling probably won't be too bad. You know, it's just reframing the brain a little bit. Any other questions? We're good?
Cheers, Mike.
Thank you.